Hello, my name is Miss Emily Sally Crawford. I am a transgender woman from McCoy, Georgia. Now it's been 11 months me being transgender. Today I will do the Vaginoplasty Series Part 2. And how do we get it and what the qualifications and loopholes and all the other stuff. Yes, it is a lot of loopholes getting surgery. When I was young, I always wanted to have the sex change operation. I didn't know at the time that I was transgender. At that time, I just want to get it. But now, look back on it, I actually saved up my money, but I could never get the operation. So I didn't know it would cost $10,000 for a sex change operation at the time. Now, look back on it. I wish I had got the operation. I wish I would have been a complete woman down there. But things happen. But now I'm 34 years old. I'm a transgender woman. It's been 11 months, me being on my journey to man, to womanhood. It's not easy. Sometimes I don't look like I'm trans, because sometimes I wear normal male clothes, but I am transgender. Okay, let's get on to this vaginoplasty. Okay, in part one, I talk about how to get it, what happened, what they do to your penis, and they turn your skin of your penis into a vagina, and they turn the skin of your labia into the skin of your scrotum into your labia, and we know about that. Now, how much do it cost? The total answer: SRS surgery in the United States will cost 10 grand. A lot of people in the United States don't have it. Back in them days, um, Social Security never recovered. Social Security never, I mean, not Social Security, Medicaid. At that time, Medicaid did not cover transsexual surgeries. Now they do. I talked to one lady, Miss Ballard. She transgender. She had the surgery too. She said yes, Medicaid do cover transgender surgeries. It's hard to do it on the Medicaid route, but it can be done, because one trans girl did have the surgery done with her Medicaid. It's not easy, and there's a lot of loophole into it. Now, insurance. Back in the day, insurance never covered transgender surgery. That was considered as a cosmetic surgery. Now, it's not. Now, insurance will pay for the vaginoplasty and the phalloplasty for the trans man. Today we're talking about the vaginoplasty. Yes, they will cover. Yes, Medicaid and Medicare will cover sex change surgeries. It it difficult to get into Medicaid, but that is the route some transgender women go. And since I got Medicaid, I might try that out. But I gotta go down to Social Security. I gotta tell them I'm transgender. I'm trying to get the sex change operation. And they want me they probably want me, how long you been on hormones? Or they'll probably send me to a therapist. How long you been on hormones? Or how many did? It a lot. Now, new protocol now is that you got been on hormones for a year. See, I not been on hormones for a year because it's kind of hard for me. Everything add up. It hard to be transgender. I ain't got much money. If I do, I'm saving up for my dress or my wig and stuff like that. That costs money. But if you really want to get it, you got to think about it. One day, I might end up getting the surgery. That a lot of trans people said, no, I don't want to end up getting it. Jamie, the trans man on the other channel, he would not he didn't want to get the surgery, then he would end up getting it. That's how most trans people really is, you know. I'm the same way. Yeah, I'm the same way. Um, this is part 2 of my video on SRS, sex change surgery for the trans woman. It's not easy getting the operation, and it's not taught that too many people want to talk about. But if you're transgender and you go into the process, the cost is you got to add up the cost. You got to know what the protocols are. That some protocol that you got, like some surgery that you got to be on hormone for a year, and there's some surgery that you got to be living as a woman for a year. And you got to have 2 psychiatry notes, and there are 2 notes that you really need for the doctors and stuff like that. And it's a talk that people don't want to talk about, and especially you're not trans. You know, I'm transgender, so uh, it's not balancing, but it is balancing. So you need 2 therapy notes, and they got to be from a psychiatrist to order that a doctor operate on you. And other than that, you got to live out as a woman for 1 year, and you got to take hormones for 1 year. I did the living as a woman part for 1 year, but I ain't took the female hormones yet. It a lot of loopholes in getting the SRS surgery. It is a lot of loopholes. And the first surgery we talk about what would they do. And this surgery, they talk about how much it costs or how much it costs to get the operation. One in America it costs $10,000, but in in Thailand it's cheaper. It's cheaper to get it in Thailand because I want to go to Thailand because it's cheaper up there, you know. You go down to America, you're gonna pay $10,000. But the problem is I don't have a passport, and I don't have a passport. You can't. It'd be hard to do that, and it'd be hard for most transgender people. And I know who want to get the surgery, they end up going to Thailand because it's cheaper. And even so, your insurance covered, we don't know how much they will recover. Sometimes you might got to pay some of the money out of it. And I look into it though, and I do I want it? Yes, but you know that what trans people is. You know, they ask me, "Do you want surgery?" Yes, I say, yes. I don't know. I really don't know for sure. But do people ask me that question? Yes. And this how much it costs. Surgery is expensive. Our surgery is cheaper than a trans man. So they surgery is $100,000. It's expensive. All like at least $10,000. It's expensive too, honey. And it's hard to save up. I know some transgender people. They have a GoFundMe page. They set up fundraisers and stuff like that. It help you save some of that money. So when you get your operation or whatever, in our next part video, it will talk about how the recovery is. that part one we talk about what would they do. Part two we talk about the cause, and part three we talk about the recovery. How long you be out? How long you be out of commission and whatever and stuff like that. This is about cause, and this is why more people go down to Thailand, and Thailand is the sex change capital of the world because a lot of people in America don't have 10,000 grand. A lot of transsexuals I know don't have 10 grand. Even Dr. Marcy Bowers is a treat lady. She transgender, but a lot of people don't have 10 grand to part with. I don't have 10 grand to part with. I don't know nobody have 10 to $15,000 for operation might not work. I'm not saying it don't work. I'm not gonna say it don't have complications, but it might do, and you got to expect that. All surgery is not perfect. You might have complications and stuff like that, and that might cost money. Yeah, what transgender people do, sometimes they have a GoFundMe page. Sometimes I might end up doing me a GoFundMe page if I think about doing it, and having fundraisers and stuff like that. Surgery is not cheap. Being transgender is not cheap. If you really want to get the surgery, it's really about saving. And now, now Medicaid covered it, insurance covered. You might got to pay some of it. So we don't know. If I know any more, I look it up. And this is about the end of what I got to say about part two. And part two, we talk about recovery. And I gotta say goodbye.